too hard about it.
Okay.
Okay, whenever you're ready.
I need to turn this on probably.
You're already on.
Oh, I'm on?
Yeah.
Okay. Okay. Welcome to Student Surgery, guys. We're going to talk a little bit about aseptic technique, and then we're going to go through all of the transitions from capping and masking all the way through draping and getting your instruments ready for surgery. So the first thing is, let's talk about cap and mask. Out here in the induction area, it's fine. You don't need a cap, you don't need a mask. You should have your lab coat on. Your lab coat is protecting your scrubs. I can get my lab coat all dirty. You could probably see the hair all over it. That's fine. When we enter the surgery suite, lab coat comes off, so our nice clean scrubs are underneath. The other thing we need when we go into the surgery suite, cap and mask. Now, what a lot of people want to do is put one of these super cute, nice caps on, but then their hair's hanging out. Now, this is great for food service. It's fine, because you know what? You get a hair in your food, no big deal. It's not going to poison you. You'll be fine. You get a hair in your patient, and unfortunately, that means an exponential increase in infection rates. So what you need to do is put one of these lovely ladies on to cover up your hair. So we can do this, all hair included in the mask. Now, if you still want one of these super awesome things on, it can go over the top. And we can show you a picture of how someone successfully did that with long hair, still maintained their cuteness in surgery. All right, then we put our mask on. Make sure you have your mask also when you go in the surgery suite. For those of you who have beards, technically we should have beard covers. We don't have beard covers in junior surgery, and so we're letting that slide a little bit, but upstairs there will be beard covers for you when you enter fourth year. So now I'm pretty much ready to enter the surgery suite, set all my stuff up, except for I still have my lab coat on. So I'll take my lab coat off, put it in the locker, and we're ready to go. All right, guys, now we're setting up our surgery suite, and while anesthesia is moving in your animal onto the table and setting them up, getting them tied in, all of their equipment put back on them for monitoring, you're going to open up your surgery pack, just the outside drape. So first thing we do is we make sure this is our group number and that it has been sterilized. Break these outside pieces of tape, and then you want to touch, your hands are not sterile. So we want to touch the outside portion of this, not the inside portion, okay? So each time you grab one, you grab the outside portion. Whoops, I went the wrong way. So I'm going to come over that direction. So it's a little bit cattywampus here, so I'm just going to fix that. Again, trying to grab the edges and the outside portion. If I don't grab, at least this is going to be underneath the table, and underneath the table is dirty anyway, okay? So see, I'm going to slip my hand under, try to grab the outside part of this drape. All right, so now we can see that this is the inside, and what I want is my table drape here to be covering the entire table. So I'm going to shift it around using my hands on the outside of the drape. So I'm not on the inside, I'm on the outside. And I'm going to shift this around so that it covers the entire table. All right, now it's time to go get the gowns ready. Okay, guys, now we're on to the gown pack. So again, I'm looking to make sure it's sterile, and then I'm going to keep my fingers on the outside because, again, my fingers are not sterile. So I got to catch this, and this is packed tightly, which is good. So I'm going to open it so that all of my hands are on the outside again, as much as possible. Now, you'll notice on the instrument pack, we did not open the inside portion. This time, we are going to open the inside portion, because otherwise, how are you going to get to your towel when your hands are all wet? So again, I'm using the outside and edges as much as possible so that I don't get any contamination on the inside of this. All right, now our towel is facing up, and after we towel and put our gown on, we'll need our gloves. So what I'm going to do is I'm going to open my gloves sterilely onto this field. Awesome, so now I'm all set and ready to scrub. Now alternatively, if you don't want to manipulate that package with the sleeves over your fingers, you can open your gloves on the outside or next to your pack by opening them again sterilely. So I'm only touching the very outside of my package. And you notice I'm doing this well away from my gown because this is all dirty. Now that I've touched it, it's dirty. So I'm preserving the inside of the package. Apparently in this package, one of the gloves is missing. That's okay, we just get you another set. And we're gonna make sure that it stays open because if it closes again, that is not ideal. All right, sometimes bending this portion under here helps it to stay open. There we go. So that would be the alternative way. I personally like to put my gloves onto the sterile field and then just manipulate it with my hands inside the sleeves. I feel like everything stays cleaner because this is a much larger area, whereas over here I have to be much more careful because this is not sterile, and then everything that I touch or is underneath this package is no longer sterile either. All right. Now that we've got our gloves and gown ready, it's ready to scrub. So scrubbing, we're on to the scrubbing part. This is a super important part. Double check you've got cap on, mask on, because you can't go back into the surgery suite without these things on. So make sure you have those on when you start. You'll find the medication soap embedded sponges over on the wall. And so you grab one of those. Now the other thing to check before you get started is, do I have gross contamination of my hands? If you've been handling your cat and you've got blood and poop and urine all over your hands, you have to wash them first. This scrubbing is to make your hands aseptic. It's an aseptic prep, it is not a rough prep. So if you have crap on your hands or you did a whole bunch of gardening last night and changed your oil and you've got grease and gross stuff under your nails, you do that first. So you get all of that stuff off, all the gross contamination first. Then we scrub. So first thing is that you open this up, and if you need help with your nails, you can open this up and then just take the little nail pick out and do your nails first. After that's all done, my nails pristine. I keep them that way on purpose. So then, I'm gonna throw that away, and then you take out your scrub brush, you throw away your little packet guy that's on the outside, and then what you do is, this is water, you just wet it. Then you get it super soapy, and you can see all of these soap bubbles. And what you're gonna do is you are gonna lather up your hands from your fingers all the way to your elbows on both sides, okay? This is all about contact time. You need 5 minutes of contact time on your hands and on your forelimbs, okay? So you can see all my forelimbs are nice and bubbly, super nice. Contact time has started. If you don't have a nice clock to show you how long you've been scrubbing, all you have to do is count 10 times on each surface of your hand. So, and arms. So then you do 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, and then turn. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, turn. So you can do that for both hands, both arms, every surface of your finger, which will end up being 5 minutes, or you can just watch the clock like I do. And through the magic of TV production, we have gone 5 minutes. So isn't that awesome? So now we're ready to rinse. So we're gonna start at our tips and go down to our elbows, because our elbows are still dirty. Look how dirty my elbow is. So, since my elbow's dirty, I don't want any fluids running from my elbow down to the tips of my fingers and contaminating my fingers. So my tips of my fingers are going to stay up this whole time. All right, guys, you should get a little wet. That's the way it works. All right, it's time to gown and glove. All right, it's time for gowning and gloving. So my hands are super wet, and they're still dripping a little bit from my elbows. So again, hands still up, elbows above the waist, hands above your elbows. My hands are also not near my face. So you can see that they're not near my face, not near anything else. You need a healthy paranoia for touching stuff now that your hands are aseptically prepped. So I'm going to pick up my sterile towel, shake it out here, And then the first thing I'm going to do is dry my left hand, because I'm right-handed. So that's the easier hand to dry. And I'm going to work the towel down towards my elbow like this so that my hands are dry. Then I'm going to rest it on my right hand, okay? Pick up the end down here because I didn't touch this end yet, so it's still sterile. Flip it over, and now this is still the sterile side. And I'm going to dry my right hand. All right, now this is dirty because I went all the way down to my elbow. So I'm not going to put it back on my sterile field. I'm going to throw it. This is the only time you get to throw stuff, guys. It's super fun. All right. So now I have my gown, and it's wrapped so that the collar is up here towards the top. And I'm going to grab it by its armpits. So now I have it by its armpits like this, okay? And I'm going to stick my hands into the armpits. And if you see, I am being super careful as to where I am in space because I do not want any of these sleeves to hit a table, our other table. I don't want anything to get below my waist, so everything's above my waist. And my arms are going in high. I'm looking above me to make sure I'm not hitting any of the drop downs or lights or any of those kind of things. And then Sally over here is going to tie me in, which makes gloving much easier. You also notice my fingers did not come out. Why? Because my fingers are clean, but they are not sterile. So I do not want to touch anything with my fingers. I'm only going to touch stuff with my sterile sleeves. All right, so it's now time to put on my gloves. So I can manipulate this because I open them sterilely. And again, only with my sleeves, not with my fingers. All right, and then the right glove. So what I do is the thumb is pointing towards me. I'm going to lay it on my thumb, and I am going to hold the glove thumb to thumb, fingers pointing at me. Then I take the edge of the glove. See, I'm still holding on to it with my thumb and fingers through the sleeve, and I put it over the top of the sleeve. Okay? Then, again, still using my sleeve, not my real fingers, I'm going to pull that up. Now, my thumb's not out of my sleeve in there. I don't know how well you can see that, but it's still covered up by my sleeve. So what I'm going to do is I'm going to pull on my sleeve to pull my sleeve up. And crap, now I got my fingers all in the wrong holes. All I got to do is, again, taking my sleeve on this hand, because it's sterile, I can do this. And I can pull on my glove, resituate my fingers, and voila, one hand done. Then I grab the other glove. Same thing. So thumb to thumb, grab the inside portion, the thumb portion with my fingers and thumb, and then lift the glove over the top, pull the sleeve down, pull on the sleeve, and fingers come through nice. Now, if you don't dry your hands well enough, it's going to be sticky, it's going to be super hard, it's going to be very, very difficult. You can fix all of these things once you get started. So I can fix this glove if it rolled up a little bit. I can unroll it. If you leave it super rolled up next to here, it's going to cut off your circulation. Your hands are going to go to sleep. So try to smooth it out as much as possible. All right, guys, now I'm all gowned, and my friend here, Dr. Spence, is all gowned, my assistant. And so now I have this little guy that I have to take care of so that I actually can cover up my backside and be a little bit more aseptic and less likely to contaminate things. Okay, so what I'm going to do is I'm going to hold both strands and untie the bow. Now, if you forget which side is which, all you have to do is look. So this side's attached to your side. If you pull on it, you can feel it. This side's attached to a big panel. That is the side you hand to your buddy, and then you turn. Ta-da! Now I have wrapped my backside, which is nice. And then all I got to do is tie a bow. Now, what happens if you accidentally drop it? If you accidentally drop it or it came untied while you were gowning or any of those kind of things, no big deal. Then your unsterile friend can tie it in the back, but then they tie it in the back, not on the side. They tie it straight in the back, and then your back is just not aseptic. Okay? All right, now we're going to move on to draping. Okay, guys, now we're ready to drape. And so the first thing you need to do is open the inside drape of your instrument pack. Have somebody drop your scalpel blade and your instrument or your light handle and any other things that you want them to drop on your table. You also go ahead and look and make sure that you have a sterile indicator strip on the inside that makes sure that the inside of your package actually got sterilized. So in this one, we're good to go. All right, so now we have our towel clamps ready and we have our drape ready. So the first thing I'm going to do is when I open up my drape, I'm going to actually step a little bit away from the table so that I don't accidentally hit the table with any portion of my drape. Then I'm going to make sure that I have a little folded in portion that's going to go towards the animal, and this is an example of the folded in portion. Then I'm going to make sure that my hands are wrapped on the inside. So if you put the towel in between your index finger and your middle finger on both sides with your thumbs facing up like this, and then fold your hands in, it's protecting your hands from accidentally touching anything that is not sterile. So then what we're going to see is our patient here is on the table and it's been aseptically prepped by my pal, Dr. Spence, who did that while I was scrubbing initially. And so our patient here is completely ready to go, aseptically prepped. But I'm going to double check. I'm going to say, hey, Dr. Spence, is this guy ready for draping?
I think we're ready.
All right, that's fantastic. So now that I'm ready with my hands, I have my drape ready. What I'm going to do is I'm going to aim for the middle and then go out. So you can start in the middle and pull your drape out, but you cannot go from outside in, okay? So if you think, oh no, crap, I pulled it too far and now I'm outside of my prepped area, this towel then gets thrown away and you get a new towel, all right? It's completely contaminated. Now this happens sometimes. It happens sometimes because someone came by and a gust of air blew it off. It sometimes happens because you just weren't paying attention, but it happens. All right, so then what I'm going to do is, of course, the perfect thing to do would be to have perfect aim like I have, and you just set it and lift your hands up as you go. All right, go ahead there, Sue. She's on the other side of the table. If I were by myself, because she was still scrubbing, I would have to walk around the table to do that side. Order of the towels does not technically matter. The other thing that you need to be thinking about is where your towels are going in relationship to the animal's anatomy. Now for a spay, you want to drape from the xiphoid to the pubis. So I don't want to stick this guy clear up here, but if I did and I thought, oh no, I'm too far up, I'm not all the way to the pubis, I actually can take this and pull it back to where it's at the pubis. All right, we've got our 4/4 drapes on. Now one thing for towel clamping, when you can touch these tops of the drapes. You cannot touch anything below, you can't touch the table, and you have to mind your sleeves. See how puffy my sleeve is hanging out over here? If I'm not paying attention, this puffy part is going to touch the table. So I'm using my elbows up approach so that I don't accidentally touch the table, accidentally touch somebody over here in anesthesia, something like that. Everybody should be paying attention. Everybody should have a healthy dose of paranoia because you can't always feel it when you touch something. So if somebody says, hey, I think you touched something, you probably did. The other thing that happens is as you're leaning over to drape something, your gown is poofy and it touches the table. So watch out. You have to have a healthy distance away from the table so that just the weight of your gown doesn't pull off of you. This is super important because that's where a lot of contamination occurs. Okay, so now I'm going to put my towel clamp in and I'm going to put it obviously in the sterile prepped area because it's going to penetrate the towel clamps and the skin. And I want it close to the edge. If I put it clear back here, even though that might still be in a sterile prepped area, these edges are going to flip up and allow contents of the abdomen to like come under the drape. If you put it close, it helps keep a straight line between towel clamps. So we're going to go ahead here and towel clamp the rest of these guys in. Uh-oh, shoot, I didn't get his skin. Now what do I do? What do I do, Sue?
You just take off the clamp?
What you do is you actually just open the clamp because it's dirty underneath. Every time you penetrate the clamp, it's dirty underneath. So you just open it push harder to where you grab the skin. Oh, didn't grab it again. Try again. Push harder. Now I got the skin. If I take the clamp completely out, I now have to put the clamp away somewhere else. I have to throw it off the table. So if you don't catch the skin, it's okay. Just open it up and try again, as long as you don't take it completely out of the drapes and animal area. It's fine. Just try again. All right. Now we've got our 4/4 drapes. We like where it is. So now we're going to go to the big drape. All right. So now this can open multiple ways. This is the way I like to do it, is I open it this direction. So Sue is going to take her half. I'm going to take my half. We are walking away from the table so that we still keep it up off of the patient, because as soon as it touches that stuff down there, it's contaminated on the underside. So now we're going to take our hands and we are going to hold the corners. Now, here's the important thing. If you take the corners and put your hand on the underside of this drape, your hand becomes dirty. So you have to still keep it up in the air. So it's okay, because it's still all folded, for us to have our hands, even though this is going to become the underside. So Sue's hand is now under. If she goes below her waist, it's contaminated. So you either switch your hand to the top and then let it down, or you just drop it up high. So those are your two choices. But if you go down below your waist with your hand underneath that drape, it's contaminated. All right, so now I'm going to steady the drape so that it doesn't get displaced, and we're going to do the other side, and we're going to go all the way to our instrument table. And so then once it's on the instrument table here, we're going to replace the instruments so they're on the outside there. And then to attach it to the table, you cannot use a penetrating clamp because it's not sterile. We didn't sterilize this table, so we can't put a penetrating clamp on it. So I'm going to use my Alice tissue forceps to attach this drape to the table so it doesn't fall off. All right, now that we've got the whole table covered, I can now use my light handle and put my light handle up. Now, you can see as I put this light handle up, my stomach is touching the table. That's okay, because I have this big sterile drape right here, and so it doesn't matter that I'm touching the table with my belly, but that's why we wait to put the light handle on until after the table's completely draped, and I can arrange that. All right, so now we've got our dog. I can feel the towel clamps under here, under the table, so I know where my incision needs to be and where to cut the hole in the drape. And we can put the blade handle on the blade and get the instruments ready that we are going to use and set them out and get started with the spay. So now we're going to cut a hole in the drape, and so Sue right there has her hand on her towel clamps, and then my towel clamps are right here. And so we know that between these points right here is where the hole in the drape needs to go. Now, I'm going to use my Mayo scissors because we don't otherwise have, these are the biggest scissors, the toughest scissors that we have in these packs. And what I'm going to do is I'm going to lift up just a little bit, cut a little bit of a hole, and then cut up. Now, there's two ways to do this. The first is the way I'm doing it, which I cut up, and then I can feel underneath where my drapes are and where my towel clamps are. And I cut a little bit of two little sidedness here on both sides. Or you can actually cut just a circle. So you can either do that and then tuck that guy under like this, tuck this guy under like this, and then we towel clamp over the top. Where's my towel clamp? So I feel that. Now you're not going all the way into the animal, you're just going onto the towel clamp on both sides. If you did it this way and your little ends keep flipping out despite your towel clamp placement, you can just cut it off. But you notice that I don't have a ton of 4/4 drape showing. I have a little bit is okay, but if you start putting towel clamps back here, you start to contaminate your area. And if you have huge amounts of white towel showing from your 4/4 drapes, then you're potentially have a problem with contamination as well.